The purpose of this video is to provide a general overview to all of you about anemia, which is an exemplar under the concept of cellular regulation. In this video, we will review the basic physiology of red blood cells, the pathophysiology of anemia, common signs and symptoms, the different types of anemias, and pharmacologic interventions for anemia. In Latin, an means no or little, and emia means blood, so the Latin translation of the word anemia is no blood. Unfortunately, things get a little more complicated than that. Anemia can occur due to a reduction in the size of or the alteration of the function of red blood cells. First question, what does a red blood cell do? Ding, ding, ding. If you answered carry oxygen, you are correct. Remember that the hemoglobin molecule within the red blood cell will bind to oxygen and carry it to the tissues where it is released for cellular function and regulation. Second question, where is a red blood cell produced? Did you say bone marrow? If you did, you win the satisfaction of knowing that you were correct. Stem cells within the bone marrow produce all types of blood cells, including red and white blood cells and platelets. Next, I want to talk about the signs and symptoms that are common in anemia. If you understand the physiologic purpose of a red blood cell, you should be able to figure out the common symptoms. What happens when the tissues do not get enough oxygen? Well, the body does not work very efficiently, I'll tell you that. Common symptoms are fatigue, weakness, dyspnea, palpitations, headache, cognitive impairment, dizziness, or apathy. Assessment signs include pallor, tachycardia, increased respirations, bounding pulse. Now, I don't know what a hemic murmur is, but the Google says it's a loud pre-systolic murmur at the apex heard in patients with anemia who have no valvular problems. So there you have it. Anemia can be broken down into four main types based upon the pathophysiology behind each type. The first type of anemia is straightforward, blood loss anemia. Makes sense, if you lose blood, you will experience a reduction in blood cells. Within the category of blood loss, you can further break down anemias into acute and chronic blood loss. Now you're probably thinking you just give the blood back. Well, let's talk a little bit about acute blood loss. Causes of acute blood loss can be traumatic, secondary to surgery, internal or third space bleeding, or GI bleeding. Initially, I used to teach you just give the blood back, but for the purposes of being complete and thorough, to treat acute blood loss, first you must attempt to stop the source of the bleeding, and then focus on replacing the blood volume with isotonic fluids, like normal saline, or volume expanders like albumin. Next, if the blood loss is large enough, you would replace the blood. Supplemental oxygen support is crucial in a patient with a more severe blood loss anemia, so don't forget that oxygenation is a part of this whole mess too. Finally, if a cause can be pinpointed, it should be addressed. Okay, back to the chart. The next type of anemia is nutritional. For those of you who are saying, hey, wait, you didn't talk about chronic blood loss, just hold on with me for a second. The two types of nutritional anemias are iron deficiency and B12 deficiency. There's also a folic acid deficiency, but that will not be addressed here. You will see here that chronic blood loss will often present as an iron deficiency anemia. This occurs because a slow loss of blood will deplete the stores of iron over time. An example of chronic blood loss anemia occurs in women with a heavy menstrual cycle. Now let's dig a little bit into these two. Iron deficiency anemia can occur from a decreased dietary intake of iron, a decreased absorption of iron, or depletion of iron stores from a chronic bleed. There are specific signs and symptoms of iron deficiency anemia, such as pica, which is a craving for non-food items like ice, dirt. I don't know about frogs. Are they food items? Chelosis. This is development of soreness and cracks along the sides of the mouth, as pictured here. Other than that, you would think about the common signs and symptoms of anemias, like the fatigue and the tachycardia and the increased respirations, shortness of breath. Treatment of iron deficiency is twofold. The first is nutritional, and is in supporting patients by encouraging high iron foods, and pharmacologic in the form of iron replacement. More on the pharmacology in a little bit. B12 deficiency anemia can occur to a dietary deficiency or due to malabsorptive states. You should remember from anatomy and physiology that B12 is absorbed in the stomach and that intrinsic factor is needed for absorption. B12 deficiency anemia due to a lack of intrinsic factor, either due to a gastric resection or due to another physiologic reason, is known as pernicious anemia. In B12 anemia, we will see common signs and symptoms as well as paresthesias and a sore red beefy tongue. That is one beefy red tongue right there. Treatments of B12 anemia is two-pronged as well, nutritional and pharmacologic. And how much of that happens depends on whether or not there's intrinsic factor. More on that soon. Hey, back to the chart. The third category of anemias that I'm going to mention is hemolytic. In this case, the anemia occurs due to an early lysis of red blood cells. A common type of hemolytic anemia is sickle cell anemia, in which the red blood cells will form into a sickle shape under stressful conditions, which then create painful vaso-occlusions. I'm just going to address this as a drive-by, since you will have learned about sickle cell in your previous courses. The fourth type of anemia is a myelosuppressive anemia. Myelosuppression is a big word for bone marrow suppression. Aplastic anemia is a form of myelosuppressive anemia. Whoops, I'll come back to this. And it also can occur secondary to a treatment. Myelosuppression indicates a reduced production of all blood cells in the bone marrow. Aplastic anemia occurs when the stem cells in the bone marrow are reduced and replaced by non-functional fat cells, secondary to some sort of stimulus, whether it be an infection, chemical exposure, or something else. Treatment modalities like chemotherapy or immunosuppressant drugs will also suppress the bone marrow formation of blood cells. The result is a pancytopenia, which is a reduction in red cells, white cells, and in platelets. So let's look at some of the anemia-related pharmacology. One way to address anemia is to provide the patient with a medication that will stimulate the production of red blood cells, called hematopoietic growth factors. Epoetin alpha, or Epogen, is a form of erythropoietin that is given to stimulate the bone marrow. You will often see hemodialysis patients on this medication. Another name for this medication is Procrit. Other pharmacologic therapy is replacement therapy. For iron deficiency, you would give iron. It can be given as an oral medication or as a parenteral infusion. Vetiver, or iron sucrose, is an IV form of iron, which when mixed and hung in an infusion looks like prune juice in a bag. Oral iron supplements should be taken with a form of vitamin C to increase absorption. Should be taken on an empty stomach if it is tolerated for better absorption. Should not be taken with calcium or other milk products because it will interfere with absorption. Liquid forms of oral iron should be taken with a straw to reduce staining of teeth. Patients on iron therapy should be sure to maintain a fluid and fiber intake. That's adequate. The side effects of iron therapy are nausea, constipation, black tarry stools. So if you have somebody on iron therapy, you would want to promote them and tell them to expect that they may have problems with constipation. Certainly anyone who has been on medications as a pregnancy, like a prenatal vitamins, will know what I'm talking about as it relates to the constipation secondary to iron therapy. Vitamin B12 can be given in oral form or via parenteral, IM, or IV route. The key to whether it should be given orally or not lies within the overarching cause of the deficiency. If the deficiency is related to a lack of intrinsic factor, the patient must take B12 in an IM or IV form because the oral form will not be absorbed in the stomach. This is a very, very important idea that needs to be remembered. We're almost done, so hang in there with me. Transfusions will be addressed in a separate lesson, so stay tuned for that. Across the lifespan, the iron requirements and dietary habits change, so there may be times when patients will be at higher risk for anemias related to nutritional intake. Teenagers tend to have a higher iron requirement and therefore may develop anemia if their dietary intake is insufficient. This is doubly true for teens with a heavy menstrual cycle. Women who are pregnant will need an increased amount of dietary iron and often struggle with the constipation associated with prenatal vitamins due to the increased iron requirement. Older adults are at high risk for nutritional anemias related to poor dietary intake. Nursing considerations for the anemic patient include, first of all, viewing the patient from an oxygenation and perfusion perspective. You need to promote optimal cardiorespiratory function, and by doing so, interventions would include frequent monitoring of vital signs, looking for those assessment findings and changes in assessment findings. Depending on the severity of the anemia, the patient may need supplemental oxygen to support until the hemoglobin levels normalize. You need to understand energy supply and demand. Fatigue and loss of energy is a very real problem, along with the shortness of breath that goes along with it. So it's important to assist the patient with understanding how to manage energy and how to conserve energy. Nutritional education is going to be very important. Most patients do not understand what are the different sources for nutrients. Mouth care is also very important. I think you noticed with some of the nutritional anemias, there were a lot of mouth problems, and so proper mouth care is going to be important, especially as you're encouraging good nutrition. This concludes the lesson on anemia. You should have reviewed this video prior to coming to the first day of class, as we are going to complete activities related to this exemplar. Thank you, and I look forward to seeing you in class.